Good morning, everybody. Dr. Vuong here. Today is August the 4th. I want to talk about this issue about schools. Since we're getting ready for schools to start up, the first thing I want to remind people is that it takes time to get vaccinations to work. So if you have a young one, 12 and older, who is in school, you should have gotten them vaccinated back in July. Now, it's never too late, so if you want to get them vaccinated now, do not hesitate. Most places, you don't need to call for an appointment. You don't need to go see your doctor. It's free. You don't pay out of pocket anything. You literally just walk up to a pharmacy and say, hey, do you have a Moderna or a Pfizer? I prefer those two. The way the data is shaking out, and this is not a Dr. V preference, but I got a Moderna. I recommend a Moderna. Pfizer, it will be fine. And then a J&J, if you can get it. This is for America. But just know that if you get a Johnson & Johnson, you will probably need a booster shot or a second dose of either Moderna or Pfizer. Some countries and states are starting to allow that. They have early data that suggests that is helpful. Remember, the J&J was tested unknowingly in South Africa and Brazil and LA and New York City, where they had all sorts of variants. So that really led to a lower efficacy rate when compared to Moderna, but it's tested against those variants. And that gives us a good ballpark idea of what might happen to Moderna or Pfizer efficacy as long as we keep having these variants. Now, school-age kids, 12 and older, qualify. It will probably be end of the year to beginning of next year before kids between the ages of 5 and 12 will be able to get their shots. So you've got a while to go, but today's August 4th. If you get your first dose, let's say you get a Moderna shot, then it's 3 to 4 weeks following that, and then you want to give 2 to 4 weeks for full coverage. So now you're talking really 2 months. You're talking October. My birthday is October 1st before you can really feel comfortable with your teenagers being covered. Now, over 600 universities are requiring students to be fully vaccinated before they come back on campus without masks. And many of them, if they choose not to be vaccinated, they're going to be tested either anywhere from daily to twice a week to once a week, but minimum once a week they're going to get nasal swabbed. After a while, that shit will get old, right? So, and remember the study from South Korea, the kids between the ages of 10 to 21 were the super spreaders of COVID starting back in the day, and we're seeing that this is becoming more true. Early on, the COVID was a disease of the elderly. Now, those patients have either contracted COVID, survived it, or have done a good job of being vaccinated. Here in the United States, over like 80% of people over 65 have been vaccinated. So that's driven the case numbers down to a younger age population in the 30s and 40s, and now the 20s and 30s. Now, granted, they might have milder symptoms, but you don't know if that's going to last because of these variants. And so you need to stay protected. So what would you do? What would I do if I was a parent and I had a child who was unvaccinated, which I do? Mason, my 5-year-old, cannot be vaccinated. She's starting kindergarten. We are going to send her to school with a mask. If you believe that parents should have American families should have the right to decide whether or not to have a mask, at least make the fucking correct decision, which is to wear a mask. Oh, but that's cruel to a child. It's cruel to a child, but you're feeding them McDonald's? You're feeding them junk food? Come on. What's one's going to do more damage to your 5-year-old or your 10-year-old? Is it a Happy Meal going to do more damage, or a mask for a few hours for a couple more months? Which one? It's ridiculous. You're giving them soda, you're giving them junk food, but a mask is going to harm them. They're watching you and your spouse fight and argue over drama. They're watching you flip, lose your shit. They're watching you stressed out about your finances, and somehow a mask is going to damage them. Come on, get real, right? We have other issues to deal with. A mask is not going to harm them. They are much more resilient. They make friends. They don't see differences in skin color like you do, that's all learned behavior. It's fucking crazy, idiotic parents. That's why I couldn't be a pediatric surgeon. I had to deal with parents. So do the right thing. If you're not going to get vaccinated, or in my case, 5-year-old, they can't get vaccinated, she's going to go to school with a mask on. That's the choice we make. Now, it happens. I've worked hard my life. I live in a good neighborhood. The school that she's going to is highly rated, and they've done a very good job. And they are very conscientious about masking and COVID. So they take a lot of protocols, and most of their faculty and personnel have been vaccinated to protect themselves, and they're going to do whatever's right for the kids. So that's where we are, and we just need to see how this goes. Now, America being what America is, I'm sure there's going to be a big flare up this fall. It will probably cool down around October and fucking flare back up again this holiday season, because we can't control our impulses like we did last year. Hopefully we can show some restraint, but who knows? Who knows now, right? Now the question is, when the new approval comes, right, are you going to do the right thing? Dr. V, why won't they give FDA approval? Why would you take a vaccine that's not FDA approved? Well, I got news for you, motherfucker. Pfizer is probably going to request full FDA approval within a month. And let's say the FDA grants it to them. Now we're talking September, maybe October. So come October 1st, if Pfizer has full FDA approval, are you going to take it? Or are you still going to make fucking excuses? Aspirin is FDA approved. Ibuprofen is FDA approved. Do you know how many bleeding ulcers I've treated in my whole life, in my surgical career, because people pop in ibuprofen like it's going out of style? What's it matter? It's emergency use. We've got hundreds of millions of doses. But you and your research seems to think you know what's best for you and your family and your parents, and you're just shoving pink slime down your kids' mouths. It just drives me nuts. Anyway, August 4th, numbers are horrible. The United States hit 150,000 cases yesterday. Did you know that? 150,000 cases of COVID yesterday. And people thought I was crazy when I said we would hit 200,000 cases again. We're almost there. So do the right thing. All right, that's my rant. Bye, guys.